We, this year, had some great success in Minnesota, even though we have a very challenging budget situation, as most states do, unless you're from North Dakota or Texas. If you are, congratulations. But if you're not, if you're from one of the other 48 states, you have a same or similar budget challenge. But we felt that it wasn't a time to shrink from some of these opportunities or some of these responsibilities or needs. We made some proposals to the legislature. They had some proposals as well, and it came down to a fairly successful year, I think, in terms of advancing technology and those capabilities this year in Minnesota. And again, thank you to the legislators who helped lead that, many of whom are here today. I know Tom Hansen, our commissioner, was here, probably went through some of this, but very quickly. Some years back, we started an e-licensing initiative in Minnesota where the prospect of every imaginable license of somebody having to fill out a form, send it in, stand in line, send in a check, do the usual shtick from 20 years ago is outdated, obviously. So we undertook initially with police officers and first responders e-licensing, and now the proposal that has been put into place will expand that in increments over time to all licensing for all professions and all businesses in Minnesota. It's going to take time, and it's pretty costly. I was thinking originally, can't we just get this stuff off the shelf? But Gov Pawlenty says no. We got to have this custom design, large systems with lots of money behind them. But the good news is that's been envisioned and authorized, and will be moving forward in increments. That's going to be a major step forward in terms of customer service, efficiency, cost savings, and the like. Number two, again, this is a 20-year-old item from the private sector, but in some areas of government still an issue. We have not consolidated and aggregated data centers as much as we should. In Minnesota, there are 36 data centers. They take up or involve almost 3,300 servers. They take up nearly 70,000 square feet of space, all for the state of Minnesota's functions. The goal and the authorization now is to get that down to 1 or 2 highly secure, highly efficient data centers that will reduce cost, improve efficiency, reduce energy, improve quality, and the like. It's a no-brainer, but it hadn't been done, needs to get done, it's going to get done. Next, we are also overhauling our entire accounting and financial system in Minnesota. This is referred to in our parlance as MAPS. Won't be called that probably in the future, but we have a $34 billion a year or biennium general fund enterprise, plus lots of special funds and lots of special financial relationships with the federal government, local units of government, and the like. This was a system that was envisioned, designed, and implemented in the mid-1990s. It is not only out of date, it's on the edge of stability in terms of being able to continue to provide the service. So we have a large, nearly $40 million investment in this new system, and it's not just about replacing the system, it's going to open up the door to an entire new set of accountability measures, transparency measures, and financial accounting practices built around the capabilities of this integrated, state-of-the-art, cutting-edge system. It's a large investment, particularly in tough budget times, but it's going to get done. Lastly, in this general area, we have a need for an integrated tax system. Minnesota has 30 different kinds of discrete taxes and tax programs, more than 30 discrete taxes, but some of which I'm trying to get rid of, by the way, but that's not working for me. They have lots of different tax programs and tax systems, and they are not integrated. So they don't talk to each other, and when people have an interface with our version of the Internal Revenue Service called our Department of Revenue, sometimes, in many cases, either electronically or actually, it's not easy for the left hand to know what the right hand is doing as it relates to the taxpayer or the taxpayer with the state. We think that can be consolidated, streamlined, become much more efficient, a much more one-stop experience, both from the state standpoint and from the taxpayer standpoint. We also recently, in March, unveiled a transparency and accountability project. This is kind of spreading across the country in a lot of different forms, a lot of different ways. But our legislature and our administration work together to have a system now where any taxpayer, any interested citizen, any stakeholder can go online and basically see any payment made by the state to any invoice, to any recipient in the state, including to the very small to the very big. And so it's a pretty user-friendly system, and it's going to be built upon and improved even beyond what we have now. But we're very proud of that, and I think it improves transparency and accountability. We've also been very active in the area of online personal health portfolios. You know, and I know that one of the things that's breaking the financial backs of the federal government, state governments, school districts, counties, cities, private businesses, families, is the cost of health care. And one part of that, and it's only part of it, is the extraordinary inefficiency in the current system. And one part of that is the extraordinary inefficiency of the backroom operations of healthcare providers and in the backroom operations of the clients. So the notion that we still have all these people in the system, including patients, pushing paper, receiving and sending paper in a world that doesn't work like that anymore, doesn't make a lot of sense. So we announced that by 2011, it's our goal to try to encourage every Minnesotan to have a personal health portfolio. There are stakeholders who are willing to develop and make available these portfolios as a first step. We will shortly have every state employee having the opportunity to do this. So rather than having to chase paper, if you have an MRI in Duluth and you see somebody for healthcare in Minneapolis, and instead of having to send the authorization there and have them ship the stuff down here, you can enter your own healthcare records, you manage it yourself in the early stage of this, and you can have your electronic medical records available, at least for the basic things, available to anyone, anytime upon your permission in a secure, portable environment and mode of transmission. So that's a good step forward. We also know more broadly that there's a great opportunity with electronic medical records under the stimulus money and the work of the federal government and the continued work of the states. We said in Minnesota, we're going to have everybody e-prescribing by next couple of years, and we've made great progress on this. It doesn't make sense for a doctor to scribble something out and then hand it to a patient who then drives it to Walgreens and hands it to the clerk at the Walgreens, and they can't read it, so they hand it to the pharmacist and they can't read it, and they hand it back to the clerk who then has to fax or call the doctor's office to reinterpret the scribble, and then they have to call back the pharmacist to get that done. That should all just be entered and done electronically. So we have mandated for our state paid for programs e-prescribing for everybody with a hard deadline. We're the first state in the nation to do that. We're also looking very seriously, in fact, have our plans to move towards uniform billing codes. If you go to the back room of a doctor's office, a hospital, a clinic, a healthcare provider, they got teams of people sitting there trying to figure out compliance issues around 15 different expectations of HMOs, insurance companies, and governments on proper reimbursement, proper submission of claims, proper reimbursements, mostly around differences in the use of billing codes and definitions around use of billing codes. So we have had a study group since 1994 in Minnesota on how to get the healthcare provider community to jointly and cooperatively use uniform billing codes. They can still have proprietary claim forms and claim practices, but at least as to the basic use of billing codes, can we please make some progress? And we met with them again. I met with them again in the summer of 2008, and this was now 14 years since they started meeting. I asked them how they doing, and what could we do to get this thing rolling, and they're still working on it, still studying it, and so now we just required it. So we have legislation that will move us forward on uniform billing codes after 14 years of study. One that